All right, Elizabeth, we are live.
Hello? Yep, you're good to start. Okay, great. Well, welcome everyone to the happy hour, witching hour, hungry hour panel on food. So I think you will be in the spirit of things, and I've changed my virtual background to allude to our food priority here. Please fill in the poll, which will close in about 4 minutes while you are joining us. And we will get started here as people are joining. So welcome everyone. As most of you are probably aware, food is certainly something that impacts all of us. And I think probably many of you on the panel, in the participation audience, have been thinking about inequity in food for a long time. We've been talking about that for the last decade plus. And I think what's been highlighted very, very starkly in the last 4 months is the lack of access and food insecurity. So we are eager today to dive into the data and see what we can learn about that. So we have a great panel today for you. We have some very expert people in the field. So we're going to start out with the big picture, and Caitlyn Misiaszek will lead us off with that from Hopkins, and I will introduce her in a second. Then we will look at the current reality, and Sue Poandl. Sorry, I'm tired, I guess. Sue will be leading us off from the United Way on that part of the conversation. And then Sha'Von, Terrell will talk about grassroots solutions in real time that are happening. So I want to start off with Caitlyn. She's from Hopkins Center for Livable Futures. They have done some remarkable mapping tools that are accessible to all of us and have really helped change the way that we understand where food is available, how it's available, from grocery stores to food pantries to urban farms, et cetera. And so we are going to have the pleasure of getting walked through her tool by her, and she may want to add some additional introductory remarks. So Caitlyn, go ahead. Oh wait, first, let's talk about the poll. So you can see up there that it looks like 62% of us live and work in Baltimore, and 23%, oh, that's interesting, 23% work in Baltimore. And then it looks like the majority, 54%, are community-based organization and nonprofits. Another 16% are academics, 8% from government, and 23% resident leaders. So we'll be very interested to hear from the diversity of folks listening in. So thank you very much for taking the poll, and Caitlyn, take it away.
Great, thank you so much. I'm going to go ahead and share my screen. All right, so my name is Caitlyn Misiaszek. It's a tough last name. And I work at the Johns Hopkins Center for Livable Future. We're based in the Bloomberg School of Public Health, and we focus on the intersection of diet, food production, and the health of people and the environment. And so the project I'm going to be speaking about today is our Maryland Food System Map. And this is our online platform. It has over 170 data layers available for people to download and then to visualize that data on a mapping application. So similar to Benia in some ways with their online database and maps, but we've really focused specifically on the food system, and we look across the entire state of Maryland. Really quickly before I get into a demonstration of the tool so you can see what we have available and how you might use it, I just wanted to give a little bit of an overview of why mapping. So we focus on maps for a number of reasons. We believe that they're really helpful to both visualize and communicate data. You might be able to see trends better through a map visual than say in an Excel spreadsheet or a table of numbers. You can layer data, so we can take multiple data sets and layer them on top of each other so that we can see how they connect or what inequalities and trends exist. And by doing that, we can then hopefully inform and create effective policies and programs and then monitor and evaluate that change. See how the data and the maps change over time. Really quickly, I just want to note, though, that maps are just one tool in our toolbox to kind of tell our community's food system story. Hearing from those most impacted, ground truthing data, and really understanding the story behind data and numbers is crucial in telling our food system story and understanding the issues and potential solutions. And then also, I just want to acknowledge that maps have historically been used to further exacerbate inequities, thinking of things like redlining maps. And so just being conscious of that, the data we're using, how it's presented, and think through possible unintended consequences. So with that said, I'm going to go ahead and launch our food system map. And walk through some of our data and examples with a focus on our new highlighted data related to COVID-19. So a lot of people are looking for data to be able to track and better understand how to direct resources in light of COVID-19. So we wanted to make sure that we include and highlight this information on our mapping application. So here's what it looks like when you first launch it. You can see that the whole state is outlined. Since we're focusing mostly on Baltimore, I am going to zoom in here so we can see what's happening across the city with a number of these different indicators. So each of the categories on the left-hand side will expand. A lot of our data are come from publicly available data sources. So things like federal databases from the US Census, from the Census of Agriculture. Some come from more of a state level. So thinking like free and reduced lunch programs, we get information from the state, WIC vendors, and then some is local, thinking about our urban farms list. That information comes from the Baltimore City Farm Alliance. And they make that information possible for us to be able to put up on the mapping application. So for our most recent data update, about a month ago, we focused on COVID-19 and created a new category at the top. So typically our data, like I said, it comes from publicly available sources. And so when new information is available, we then go to that entity, gather the information for the state of Maryland, and then our GIS specialist or our map specialist at the Center for a Livable Future, he takes that information and puts it up on the site. So we really maintain a lot of the updates of the data, and we do that on a quarterly basis. But since we know that people need to see this information, the information related to COVID at a more frequent basis, we actually pull in the information from the agency itself. So as the agency updates their information on their end, it automatically updates on the map itself. And so that's a new feature for us, and something we hope is helpful for people looking at this information. That also means, though, that in terms of downloading it, you'll have to go to the actual site listed here to be able to do that. So I am going to walk through a few examples of how you might use this information. I'm going to go ahead and just put on our county list so we can outline Baltimore a little bit more. So first, as an example, thinking about where we might want to start a new program or a site or increase capacity at an existing site, offering food for those who might be in need. First, we might be interested in understanding where across the city people are living and where they could benefit from a program like ours. So one data layer that we included this time around in COVID, in our COVID category, is the CDC Social Vulnerability Index. Now this is from 2018, and it's managed by the CDC, but essentially what it is they take a number of census data and they wrap it all together up into this index so that we can see where communities may exist that need additional support across the city. And so we can look at it at a county level, or we can, since we're looking at the city, we want as detailed information as possible, so we can look at it at a census tract level. And so this gives us a little bit of an overview of where across the city there might be populations, vulnerable populations, that are in need of food assistance for the program that maybe we're trying to figure out where we could locate. So in addition to that, I mentioned the maps are really great because you can layer information and start to see these connections. And so perhaps we want to make sure we're not duplicating efforts with the Maryland Food Bank. So these are all their different sites across the city currently. And so we can see where they're located, and a lot of them are located in areas that are identified as vulnerable areas. And so as our program, as we're trying to figure out where to locate, we can look and see where might gaps be across the city, and where might we want to put our new site or increase our capacity at our site. And so we might see some gaps over on the east side and think maybe that's a good place to locate. But then we might be interested in understanding the population a little bit more detail, who lives over there and how might we best serve them. So we could look at % of adults with limited English ability. And again, we can look at census tract. And here we can see on our legend, the darker shades are a higher percentage of adults 18 years and over who have limited English ability. So if we're thinking about putting in a new site or program in that area, then we'd want to make sure that we have staff who can speak the language of the community. We want to make sure that we have resources that are translated appropriately, or the food that we're offering at our site is culturally appropriate. We may also be interested in understanding, are there any children? Maybe the site should be at a school. So we could look and see what % of children who's living in a household with income below the poverty level as well. So these are just a few examples of ways you might use this information. I do want to show a few other, because obviously really all of this data you can relate back to COVID. And get a better sense of how the food retail system, how health, how nutrition assistance relates to COVID. And so one additional indicator that we might look at in terms of food insecurity is looking at those that are participating in the SNAP program. And so this information is from the American Community Survey. So it's not the super current information that's available on more of that monthly change, where we're going to see that really big spike due to COVID. But this can still give us a little bit of a sense, again, of food insecurity and those that are participating in this federal nutrition assistance program. What we might want to do on top of that, again, is understand who's living in these different areas. And so we know that there are racial disparities in health and food. And so since some data aren't disaggregated by race, one way we can look at this is to then look at our race category itself and kind of toggle back and forth and see. These are the areas, the yellow areas are areas where Black or African American population live, and we can see that those are similar areas of people experiencing or are participating in the SNAP program, and therefore may be experiencing a higher level of food insecurity. And so this is really, I think, powerful way to start to illustrate racial disparity in food insecurity. I'll show one more, looking at, and people may be familiar with this, our healthy food priority areas layer. This is something that we did. It's a little bit older at this point, but I think still worth sharing. It was a project that we did with the Baltimore City Food Policy Initiative, and the date of the layer is 2018. And it really focuses in on healthy food availability in food retail stores. And so we do look at income and transportation, but really focusing on the food retail side of things. And so this again is showing areas across the city, another indicator you can use to understand where people might be experiencing food insecurity. And again, we can overlay that and see how does race play into this? How do we look at people that have limited English ability? And so you can layer these different pieces to start to understand who are the vulnerable populations, and how can we best provide food assistance to them. And so I'll just end with saying that we're always interested in gathering additional information for these different categories. That's COVID-19 is new. It's something that obviously there's more that could be added there. And so understanding how others are using data and information, and how we can then put this on on this application so people can see and overlay different data layers and create maps and visuals to then advocate for, communicate, and plan for different solutions. So thank you.
Thank you very much, Caitlin. And I want to do a couple housekeeping things that I forgot to say at the beginning. First of all, we encourage your questions in the chat function. So if you have questions, please put them in the chat, which you'll find at the bottom of your screen, sort of in the middle, for those of you who haven't been using Zoom 12 times a day. The presentations will be emailed to everyone that was registered. So you don't have to worry about trying to scratch down the websites. Those will all be sent to you. Caitlin, we did have one technical question that for you right now that I think we'll do before, otherwise we'll hold general questions to the end. The question is from Catherine, and it says, does the Center for Livable Futures have a relational database management system or enterprise GIS system? Or are you operating with a folder structured geodatabases?
That is a very technical question, and we have a GIS specialist that works with us that would be able to answer the question, and I will definitely write that down. I believe we have an enterprise GIS system, but I don't want to give you 100% answer there. So I will make sure to have him answer that, and we can get back to you.
Great, thank you very much. So Sue Poandl is our next panelist. She's the Associate Vice President at the United Way of Central Maryland, and she oversees the 211 hotline system. So she is on the very front end. She has worked at every aspect of the 211 hotline, so she hopefully will be able to answer lots of questions about it. But she is on the front end of seeing what have been the primary calls in the last 4 months and having the requisite data to compare how that compares to last year at this time. So I will let her start, and Sue, if you have anything you want to add contextually, please do so.
Great, thank you, Elizabeth. Well, thank you all for being here and listening today. Food security is such an important topic for us to continue to work on, and has always been near and dear to my heart pre-COVID, but especially right now in this moment. So as Elizabeth said, I've been with United Way. I've worked within 211 that entire time within United Way of Central Maryland for the past almost 9 years, and I've worn a variety of hats there. And 211, just kind of a little bit of background, is an information referral helpline. There's 4 call centers in the state of Maryland. And so if you are in Central Maryland, Baltimore City, Baltimore County, Howard, Harford, Terrell, if I didn't say that already, Anne Arundel, then you would dial 211 and geo-route to my call center in Baltimore City. Really a helpline. So our goal is to, hold on one second, let's switch into, Okay, so our mission is to skillfully, can you all still see my screen, my slides? Oh.
Yep, you're good.
Okay,
you're
perfect.
Good.
Thank you. I lost visual of you all when I did that. So our mission is to really connect the community to the resources that we know are there, to help people navigate the system to get connected to those resources that people are in need of. And that's anything and everything that is from a nonprofit, from a government agency, from a church. Really, if you can think about a free or a very low cost or a sliding fee scale kind of assistance, our goal is to connect folks to that program. Because the programs are hard to get to and because the system is hard to use. And so really our goal is to do the best that we can to skillfully and compassionately connect folks to those resources. So people dial 311 just like 911 or 411 and they get connected to us. And then we ask a series of questions and really clarify. The folks on the phones are human service workers, have a background in some type of human service. Many of us are masters in social work level folks. And so really we're coming at it from that strengths-based perspective. We're really hoping to connect with the caller and hear what they have to say and get them the help that they have identified for themselves. We're not trying to force anything upon anyone, but really we want to hear and reflect and let them know that someone is here and listening. 211 is in all 50 states and Washington, D.C. and Puerto Rico and Canada. And like I said, our call center is in Baltimore City. So in 2019, our call volume was 107,000. So for fiscal year 2019, from July 1 through June 30th, our max call volume was 107,655. The bulk of that, as you can see, is heavily in Baltimore City, followed by Baltimore County. Now, I do not have our fiscal year 20 call volume to compare this to. I'm so sorry I didn't have time to get that before this presentation, but we had somewhere in the neighborhood of 130,000 calls this fiscal year. And if we looked at that, you would see very similar, Baltimore City being the highest area that we're getting calls from. So in that fiscal year 19, our highest request was housing assistance. And this is the first time, so that's for all of Central Maryland. That's the first time that housing assistance has been that top request. So housing assistance meaning shelter, meaning rent assistance, meaning mortgage assistance, anything connected to housing is in that category. Prior to that, though, the 10 years before that, the top request was always utility assistance. So I need help paying my BGE bill, etc. Now, as you see here, number 4 is the food request, and that was in fiscal year 19. Again, I did not pull those fiscal year 20 stats for you all, so we're going to not look at the whole period of time, and I'm so very sorry for that. But you'll see some significant changes when we move on to what's happening since COVID. So in Central Maryland, and we're looking at from March 16th through July 3rd. So that pretty much the whole COVID time that we have been taking calls since we went remote. So we went remote March 13th at United Way of Central Maryland. We went remote on March 13th, and we have not been back to the office since then. In that period of time, our top request in all of Central Maryland has continued to be food assistance, followed by healthcare. Now that, keeping in mind, 211 was stood up as the COVID information system by the governor during this period of time. So even with that, our top call was still food assistance, not healthcare assistance, not COVID-related questions, not test-related questions. Food assistance has continued to consistently be that top request for all of Central Maryland. In Baltimore City, same thing we're going to see here. Top request is going to be food assistance. Second is going to be healthcare. Again, the bulk of our calls are from Baltimore City. Always, that's always been the case. Not a huge surprise. And what we're seeing in Baltimore City, again, is the top request in that period of time from March 16th through July 3rd is food assistance. That's significant. That's a huge amount of people who are in need of help with food. And we have shifted to be able, really in this period of time, our call volume has skyrocketed. Our incoming calls typically are somewhere in the neighborhood of 400 to 500 a day. On one day in the middle of COVID, we exceeded 2,000 a day. So we went from a pretty, our normal call day exploded. It's dropped down a little bit. We're seeing that creep back up again now. We're now somewhere in the 800 range a day, which is still significant. We have, for all intents and purposes, have 9 full-time staff people who are taking our calls. We also, since COVID, have brought in volunteers. We have brought in some extra part-time staff just to be able to help manage and deal, the capacity, we just didn't have the capacity to sustain it. So we've really, the need has skyrocketed, and for us to keep up, we had to bring in extra folks. All right, so this just shows you a breakdown by jurisdiction. I know we're talking about Baltimore City in particular, but I think there's something to be said for seeing how it breaks out throughout Central Maryland jurisdictions. Again, Baltimore City being 68.9%, followed by Baltimore County being 21%. So it's pretty significant. And I did add a slide here. So in Baltimore City, we're looking at June 1st through July 17th. And the top requested calls during that period of time coming in from zip code 21215. So on our incoming calls, we always identify the zip code that the caller is calling in from. So that's a really consistent piece of information that we're able to look at and see where those calls are coming from. We have, in this period of time, we've really increased our partnerships. We've always had a very strong working partnership with Baltimore City, Maryland Access Point, the folks who do senior information referral. And in this period of time, we have increased and work much more significantly and have met with them most often on a weekly basis to really make sure that the folks in need of food assistance in particular are getting that connection. And so we will oftentimes, if we have a caller call in who is a senior or who has a disability that they're receiving income for, we will connect them directly to Maryland Access Point. If it is a time where MAP is not working, we are going to email the folks at MAP and get them connected to that emergency food assistance. And so really we're doing it based on the need and if it's a dire need. So we're identifying with the caller if they have food for today, if they have food for tomorrow, do you have food for the next week? And if not, we will escalate it to Maryland Access Point if they're a senior. Also during this period of time, we have partnered with DHS, Department of Human Services, and they have, initially it was a separate program, now it's the Amazon Box program, and so we do intake for those food resources for folks who are not able to get out to a food pantry, who have no way of accessing other food assistance. And so we do those intakes as well for anyone, not just in Baltimore City, but throughout all of Central Maryland. In the last probably 6 weeks or so, we've set up a program with DoorDash, looking to make a longer term food connection to folks. The Amazon food box is really meant to be a very short term immediate response, whereas DoorDash is meant to be a longer term weekly food response. And so we've started that program as well in the past 6 weeks. And we also have a partnership with Lyft. And so we are able to, if folks don't have a way to get to a grocery store, if they have income to go purchase food, but they have no way of getting there, we can, or to the food pantry, we can schedule a Lyft ride for them. We do once in a lifetime Lyft ride. So if it's something, it's not an ongoing sustained situation, but it's something and it's immediate assistance if that's in need. Oh, I think I just lost where you can send your text to. Hold on. Oh, there we go. Okay, so 211, you can text for resources in addition to calling or going onto our website. And some people really want to talk to a person, and so they can always dial 211 in that instance. But if what they'd prefer is to text and get those resources, they would send a text to 898-211 and include their zip code. And then the person who is on that chat would request or would send a message back asking what they needed help with. And so they're able to actually, you can get resources texted directly to you. And in this period of time, we have set up the MD Ready for text alerts that are related to COVID. So if you text MD Ready to 898-211, you will be opted into the COVID alerts that are being sent out by the governor and MEMA, et cetera, and 211 facilitates all of those. Okay, so our website, if you are someone who likes to go online to get information, you can always go online and gather the resources that you need. And you would just go to 211md.org and you'd be able to put in the location that you're at and narrow it down based on what you are in need of help with. And if folks are interested, they can always support United Way's work to help our neighbors and our neighborhoods recover and rebuild. And you can visit uwcm.org/COVID recovery. And I just have left in my contact information. And so feel free to always reach out and talk with me if you have any other questions. Thank you so much, everyone.
Thank you, Sue. That was fantastic, and I think it's stunning to see the need. I think it's really overwhelming for all of us, and so we're and I think it's very helpful. I think one of the examples of how data is helpful is that gives us a picture of what we're talking about. So we may feel it in the community, which is what we're going to talk about in a minute. We may feel that need in the community. We may recognize it. Being able to quantify it, I think, can be very, very helpful in terms of not just policy, but also identification of where those gaps are. So I think we will get to round out our panelists with Sha'Von Terrell, which is going to be a great way to hear how does one operationalize these things on the ground? How do you take this data and use it to really help folks on the and at the grassroots level. So she is here representing the Black Church Food Security Network, and she has been with them and done other work in food sovereignty and food access. So Sha'Von, if you want to add anything to that and start your presentation, we look forward to it.
Hi, everyone. Good afternoon. It is so good to be here with you all talking about food security. I think it is so important to talk about it now, especially in this moment. So what my presentation will seek to do is discuss it from a community-based and a community-led effort called the Black Church Food Security Network. So Priya, you can go to the next slide. So the Black Church Food Security Network was founded in 2015, and our mission is to create a sustainable community-centered food system that is anchored by churches and producers, that is led by those that are directly affected by food inequity. And that is so important in our work to ensure that we have a direct hand in the community in every phase of the development process, as well as that the community has say so in how that development process would play out, as well as in the programming in their communities. And I want to add that we are not a food charity organization. We are a self-help organization. And I think that is particularly important now to make that clarification, because we were founded before this pandemic and before this crisis that we're experiencing. But one thing about food insecurity, and if you look at the data of the people who are disproportionately affected by food insecurity, you see that Black people are. So we are aiming to create the systems to support Black communities in addressing food insecurity in those areas. So Priya, you can go on to the next slide. So much of our work is rooted in food sovereignty, and food sovereignty is the right of people to healthy and culturally appropriate food produced through ecologically sound and sustainable methods, and their right to define their own food and agriculture systems. It puts the aspiration and needs of those who produce, distribute, and consume the food at the heart of food systems and policies, rather than the demands and markets and corporations. And like I was mentioning before, like this is particularly important because everyone has the right to define their own food system. Everyone has the right to have food that is culturally appropriate. And that is the aim of our program. So Priya, you can move on. So we do this through our three major programs: Operation Higher Ground, the Soil to Sanctuary Market, and the Black Church Census. Operation Higher Ground is where we start agricultural projects on church-owned land. The Soil to Sanctuary Market is where we transform parking lots, multi-purpose rooms, outdoor spaces into farmers markets. And the Black Church Census is basically an asset mapping project that seeks to quantify all of community on assets as well as church assets. So we partner with churches in Baltimore City to start community gardens as well as farmers markets. So the little stars that you can see on this map are our partner churches. And so far we have 10 partner churches within Baltimore City, and 8 of those churches are located in healthy food priority areas. There are 4 indicators that go into creating healthy food priority areas, and those are your neighborhood is further than a quarter mile from a grocery store. 30% of the residents at least don't have access to a vehicle. The median household income is below the federal poverty limit. And the food retail outlets in that particular neighborhood do not sell those staple foods such as fruits and vegetables and bread. So when you look at the red spaces on the map, which are the healthy food priority areas, you see that they are clustered in West Baltimore as well as East Baltimore. And these neighborhoods are African-American Black communities. And that's why it is so important to root community-centered food access and food sovereignty programs within the community, because those churches are there to provide those direct resources to that community. You can go to the next slide. So I want to highlight one of our churches. So Pleasant Hope Baptist Church is the founding church of the Black Church Food Security Network. So when we go back to those 4 indicators of creating a healthy food priority area, those are not found in Rosebank where Pleasant Hope is situated. So they don't, when you look at it from the top down, you would think that this neighborhood don't have any issues in regards to food insecurity. They have access to a market, a grocery store, they have access to a car. The median household income is not below the federal poverty limit. So you will assume that they wouldn't have any food insecure issues, right? So if we go on to the next slide, Pleasant Hope decided to create a garden to address the food insecure issues within their community, as well as within their congregation. So the pastor of the church, who is also the founder of the Black Church Food Security Network, realized that many of the members of the church were experiencing diet-related illnesses. So they transformed 1,500 square feet into a community garden that produces 1,200 pounds of produce each year. And you can go on to the next slide. As well as this church operates a market. And I conducted a survey to see how many people that attend this market are experiencing like food insecure conditions. So the outputs of the survey revealed that since becoming a customer of the Soil Sanctuary Market, 34% of the respondents have increased their consumption of fruits and vegetables. 11 out of 32 respondents worried about their food running out before they receive money for more. So when you think about the data that goes into creating a healthy food priority area, it didn't necessarily capture the individual experience of the people who actually attend this church and the market, as well as the people around the community who attend this market. So although when you look at it from the bird's eye view, you don't see any food insecure experience with the individuals in that community, but the survey revealed that 11 out of 32 of the respondents who completed the survey actually worry about their food running out before they receive money from more. So this market serves as an anchor and a consistent outlet where they can purchase food each month. And the last one is 45% of the residents, I'm sorry, y'all. 45% of the respondents rate the freshness of the items sold at the Soil Sanctuary Market better than where they currently shop. And then we can go on to the next slide. And then so this shows that we are replicating what we are doing at Pleasant Hope Baptist Church into other churches across the city. And we are using those church assets to be used to anchor their community by providing fresh food, as well as to get churches engaged in thinking about the different components of the food system. And you can go on to the next slide. And as a result of that programming, we have churches that are emerging in cities across America who are thinking about food insecurity issues, who are thinking about how they can anchor their communities by addressing those needs and those gaps. And if you want to stay connected to the work that we're doing, add us on Facebook, Twitter, and Instagram, as well as check out our website for more information. Thank you. Oh my God,
Thank you, Sha'Von. That was fantastic. I think all those pictures probably made us hungry. So I'm going to lead off with a couple questions, and then I would encourage those of you that are listening in to start populating the chat with any questions you might have. And before I do that, I guess I wanted to ask if the panelists had any questions for each other. Do you all have anything that you want to ask each other? I'll start with one of my questions and you can think about that. I didn't warn you of that. So Caitlyn pointed out the fact that maps have been used in the past to perpetuate inequities. I thought one of the questions you all might be able to answer is, how can data help address equity issues? How can we use access to data to address some of the equity issues in food security? And if you have an example of how you might have done that, that could also be helpful to the participants.
I think I can answer that, be the first to answer that. Data can be used So much of our work, like I mentioned before, is rooted in food sovereignty, and that's allowing people to define their own food system, as well as to allow people to define their own success in regards to these programs and in regards to these initiatives in community spaces. So data can be used to go deeper. One of the things that I do and I challenge in the work that I'm doing is the 4 indicators of the healthy food priority area, right? I don't think that those 4 indicators of a healthy food priority area actually gets to the root of the problem of food insecurity. There is another definition that I wish I would have added to this presentation is food apartheid, and that looks at the systemic policies that went into creating food insecure areas, such as predatory marketing, such as lack of access to land, such as pollution, such as different things that created food insecure environments and neighborhoods. And I think data, looking more deeply at the root causes and allow the community to have a direct hand and input, and what data metrics and data indicators are important to those successes of those programs.
And I think there's just no disputing it. Like when we are looking at the data, we see that the need is there and the inequity is there, and the significance of that, especially right in this moment during COVID, is high. I think, you know, it's not new. Food insecurity is not a new problem, but we are looking at this data and really seeing it exacerbated in this moment, and it's so important to use it to do good and to move forward and to change the narrative.
Yeah, I'll just add, I think that the visual of the map is just, there's no denying it, as you said. Like, it's such a powerful communication tool that it really highlights where there are these challenges. And to Sha'Von's point, I think with the healthy food priority areas, I think she's spot on. I think that project itself was useful in a number of ways. However, there are so many, it's open to critique. And I think the point that those that are most impacted by food insecurity, by health challenges, are the ones that should be defining what to measure and what does progress look like for their own community. And I think that's why it's so crucial to have groups like the Black Church Food Security Network to be able to take some of this information and then say, okay, here's what it looks like looking at this data, but this is what it's missing. This is what we need to focus on. This is what we need to be able to move forward in our community. And having some of those experiential stories and that qualitative data really builds that as well.
Caitlyn, I remember you talking about that at your presentation, the whole need for to contextualize the data, and I think panels like this are really important for that. So I think as you think about your interactions, I think that, you know, one set of data might look at a certain amount of things that's not really what you know, Sha'Von's groups necessarily even want to know. Like you said, the definitions may be wrong. So I think, or they may not be inclusive enough. So I think that's important. Another question I had is, what changes have you experienced since the pandemic, and have you been able to use data to guide your pivots in operation at all? I know it's been quick, so in some ways we haven't had time to reflect on the data, but you know, 211's data is pretty much in real time, and I don't know how, if at all, folks have been able to use that, and those of you on the phone who might be in neighborhoods, you know, certainly looking at maps or seeing where calls are coming in for food, if that's been able to impact the way that you're operationalizing access to food.
So for us, not within 211 exclusively, but because of 211's data, United Way started giving out community operating grants to folks on the ground doing food assistance, and really stood that up very quickly in the light of COVID because of that need. So I would say that that's the biggest thing, in addition to, for us, our partnerships with DHS and getting that emergency food out to folks who don't have another way to get it.
One thing that I can add is how we pivoted during this time. Like I mentioned before, one of our programs is to host farmers markets in church spaces. But because of COVID, we were unable to do that. but we still want to support our farmers that is a part of our network. So we pivoted to creating a map, a Black farmer map, where people can drop in their location, drop in their address, and find farmers that are in their areas, that are in close proximity to them. And that map is actually located on our website, blackchurchfoodsecurity.net, if you want to support farmers and buy directly from farmers during this time.
And have you found that your membership has used that? Have they been able to get to those farms, or those farmers making any deliveries, or how is that happening safely, particularly for older residents?
Yeah, so that's a great question. People have been using the Black Farmer Directory to purchase produce directly from farmers, as well as a lot of farmers have pivoted themselves and adding a delivery option, as well as they have CSA boxes where people can subscribe to have a monthly box of produce dropped off at their doorstep each month or on a weekly basis based on their preference. And we have seen that a lot of more farmers have subscribed to our map as a result of this, because they can no longer go out and do those vendors, do those markets. So the only way to increase promotion during this time is to join those maps and join those directories.
So there were a couple questions I'm going to sort of combine that asked if you all work with other churches, farms, and farmers and markets in the city, and also if anyone has worked with food trucks or Arabers.
So we do work with churches in the city. I don't know if I can say this, but I think I'm gonna say it. So if y'all are connected to any churches, feel free to connect with us so we can help you think through your garden process as well as your market process. One of the things that we are thinking through as a team is how we can create CSA boxes for Baltimore City and for the residents in this area. Have we worked with Arabers yet? No. I actually had it on my to-do list for this year, for this market season, to reach out to them. But COVID hit, so I think I'm going to do more of the relationship building and see how I can add value to the work that they're doing during this time.
Is that, do either food trucks or Arabers appear on any of your maps, Caitlyn or Sue? Are they any of the places that are referral partners for your phone calls? Yeah, okay. I've always wondered about that. Here's a question that's just come in. There was an article in the New Yorker about dollar stores. I don't know if you all have seen that. It was a ProPublica New Yorker article, and the location of dollar stores seems to overlay with the healthy food access need areas. Has there been any advocacy locally to try to encourage them to include healthy food, or are they, as the question says, just impossible as it seems they are from the article? Has anyone worked with dollar stores or any of the discount stores at all? Okay.
No, I'll just note that is a nationwide trend, that dollar stores, the growth in dollar stores in across the nation has really been quite huge. There's a number of articles out there looking at this. We haven't specifically done any research around that, but with our healthy food availability survey that we did, that data feeds into the healthy food priority areas. Dollar stores kind of trended, they had a lot of food in the sense of like canned food, but not fresh food by any means. And so that's definitely something that people are concerned about.
So that sort of segues into two questions, and I'm going to combine into one, which is essentially, what is the story with citing grocery stores in these areas? Is it just a lost cause? I know that it's been an exercise in frustration. Is there any effort to use the data to try to figure out how to get more regular store access to food in these communities?
I can start on that too. I think that there's been, historically, there's been a really, people tend to look to grocery stores as being kind of the solution to the issue. And that's just not not the case. There's a lot of research now that shows that even if a grocery store does locate in an area, it may not be affordable, it may not be culturally appropriate. People may not feel comfortable in that store. It's not to say that it's not a helpful solution in the sense that it can be part of a larger solution, but it's not going to be the reason why people then all of a sudden have this ability to purchase and eat healthy and have better health outcomes. So I think it's something that people have started to pivot away from. It's also really hard to get a grocery store to come in. They need a lot of land. They need parking. They need a number of different factors that they look at in terms of locating in different areas. And so it can be difficult, and it's definitely not the like silver bullet solution that I think once was the case. And so people are starting to come up with more creative ideas, looking at, as Sha'Von has mentioned, a number of the programs that they're working on with their communities.
As a follow-up to that, one participant says, we are seeing fresh produce being wasted and not used because families do not have the tools or skills to cook. Are any of you all seeing that?
I can take that. So I'm moving around a lot because it's hot in here. I'm at the church. So just in case you see me moving locations throughout this discussion. But I think I think we have to challenge our assumption when doing community-based and community-centered work. And assumption is like the definition of healthy food, right? I think a lot of people who do like food chariot-oriented work, but people that's doing the work look at healthy food having this one definition, right? You need to have carrots, you need to have tomatoes, and you need to have something else like cherries, right? But that's not necessarily conducive to the culture of that area. And I think we have to challenge that assumption, right? When we're doing this work, we just got to bring in the food that we have access to for the people who are doing these food drop-offs, but we will have to have the conversation with the community around like dietary preferences, cultural appropriateness. Because I think one of the things that we do is like we give people food and we say they're not using the food correctly, that they don't know how to cook the food is going to waste. But there was never a conversation with the community around like what are your food needs actually, because if you were to give me some arugula or some Russian kale or some Swiss chard, I would be like, what is Swiss chard? How do I cook this? But if you were to give me spinach or kale or collard greens, that's more in line with my culture, and that's more in line with what the food that I know how to prepare. So I think to the answer, before we assume the community needs, I think we just need to have a conversation around like what are your food needs and what is your culture as it relates to food.
And that piggybacks on a question someone also asked about if there was cultural sensitivity to food in schools and other places. And I don't know that there's a layer of that on your map, Caitlyn, but I think trying to make sure that food, when you were overlaying the layers of demographics, you did mention, if you were to locate something in a area where English wasn't spoken as the first language, would you have folks that could speak those languages, and would you have food that was appealing and appropriate for those populations? So that's I think an important theme that's coming out here around making sure that those who are the impacted communities are part of the conversation, or maybe even driving the conversation. We have a question here that says, how can you use current COVID data to keep the support of free food programs that many people right now might become dependent on? Another question that I want to make with that, and this is for you, Sue, is do you have any idea if the folks calling 211, if the surge in calls is from new people that have lost their job, or are these people who have previously can't get to food? Do we know anything about why there is what are some of the things that are driving the surge in food requests?
I don't have great data per se. Anecdotally, it's a mix. Certainly the folks who called previously are still calling. There are some new folks who are calling now who have lost jobs. There are more new folks calling now who have lost jobs. I don't have that data in front of me to back it up, but I could certainly pull it. But yeah, people, I mean, in this moment, you know, things were rough pre-COVID. People didn't have great access to what they needed pre-COVID. And so in this moment of COVID, where jobs are just, you know, it's not the same. The access is not the same. And we're coming to the end of, you know, the extra folks who are receiving unemployment at the end of July will lose out on an extra $600 a month. And we expect it to continue to change as utility assistance moratoriums and rent assistance moratoriums and mortgage, et cetera, as that comes back online, and people are, you know, it's going to get worse, unfortunately, before it gets better, in my opinion.
There was an earlier question around housing, if you expected there to be an increase in those calls with the courts reopening. And
yes, we absolutely expect. August is historically a low month for us, and this August will not be. Yeah, we expect a tsunami, as they say, of folks calling in needing housing assistance.
I think one of the things that happened at the very beginning of the pandemic and has leveled out to some degree was the total shock to the food supply system, really to everything, right? And this was across the board, regardless of your economic situation. You could not find food in the grocery store. It was just the food system broke down. And I think for many of us, that was this moment of saying, maybe people will finally appreciate the value of the local food system and the fact that, you know, the local food system didn't necessarily break down, right? That if your garden was at your church, you could still get the food from your garden. There was no breakdown in the transportation of that. Have you all seen that leveling off? Someone suggested that may happen again, that there's going to be another expected interruption. I hadn't heard about that. Have you all heard about any additional expected interruption in the food supply chain, and or, you know, how have you all positioned, and how can we use data to position local food providers as a more significant link in this chain?
Yeah, I can say that I know that there's a mapping application that was created with farmers across the state who were doing direct sales. For a while, their farmers markets were not going to open, but then the state did deem them essential. And so a number of them had the ability to open. However, yeah, I think it's been really interesting to see how the shift in consumer spending has changed. So with institutions shutting down, with schools no longer serving as many meals as they were previously, with restaurants shutting down, a lot of these larger farms that relied on those as their main markets had to shift. And some of these local farmers, some of them had a more diversified market basket, and we're seeing that is, crucial for some of these farms to be able to adapt and say, okay, I'm able to now sell to more consumers, to more retail. And so seeing that happen, I think there'll be a lot of lessons learned. I hope a lot of lessons learned across the food supply chain, that people will be able to adapt, change their business model to have more of a local regional market and be able to withstand some of these shocks to the food system if this were to occur again, or if there's another kind of a wave that comes along.
Can I add something?
Absolutely.
So one of the things that I do want to add is I do think there is a second wave coming, and I do think it's going to affect our food system once again. And I think the time is now to start having those conversations about food preservation. Because right now we have the ability to buy directly from farmers within our area. But if there's a second wave in the wintertime in Baltimore, we won't have that opportunity to buy directly from farmers in December, once this growing season is starting to end, or January. So I think one of the things that we have to start doing now, in the spirit of like food sovereignty, like putting the ownership and the control back to the people's hands who are eating the food, who are consuming the food, start having classes on food preservation. And that's what we did during this time, because we know COVID-19 has disproportionately affected Black people in regards to the death rate, in regards to the people who are the essential workers. So we want to be able to equip our community with the tools now to prepare for what is yet to come. So on our website, we have food preservation classes on how to freeze your food, how to can, how to properly store your food. So when that time comes, again, where the grocery store shelves are empty, again, we won't be scrambling. We will have what we need in order to sustain ourselves throughout the winter.
I have a question here that says, when people are calling 211 for food assistance, where does the United Way refer them?
That's a great question. It really depends on what they need. It depends on where they're located. It depends on what they want. So the specialist is really going to work with the caller to figure all of those things out first. The goal is to connect them to the closest provider, if you will, that they're trying to get to. So typically if someone's calling in for food assistance, they know they want a food pantry, or they know they want to figure out how to get food stamps, or et cetera, et cetera. So really we're going to work with them to figure out what it is exactly that they want and get them connected to what it is they want that's closest to them. Our goal in this is to not send them 10 miles away, because oftentimes, most all of the time, if you have food insecurity, you may have transportation struggles. So we don't want to add to anyone's stress, and we're going to just talk over with them what we have and give folks options, because again, we want them to be really, the person who's calling knows what they want, and we want to get them connected to whatever it is that they want. So we have church food pantries, we have other larger food pantries that we're connecting people to. So it just depends on what the caller wants, and it depends on where they're located. So I'm sorry if that's not a great answer.
No, I think that's a great answer. Caitlin, here's a question for you. It says there are dozens of community schools in Baltimore City, and each of them has a community food pantry. Is this resource reflected in the maps? And also, is there any data on the effectiveness of school-based pantries in fighting food insecurity? What if every single school had one?
I was actually just typing a response to this.
Okay.
So the way that our, the data list from the Maryland Food Bank, it does indicate whether it's located in a school. So that information is available. I will say that it was a really great research project that was done by a faculty member at Hopkins. Her name is Dr. Kristen Mari, and she did focus groups looking at food insecurity among adolescents across Baltimore City and the use of food pantries, and found some really, really interesting findings. And so I'm not going to share too much on it, just because I will share the link so that people can take a look at that. But it was really well done. And she focuses on that specifically, food insecurity among adolescents, which is not talked about quite as much, I don't think, in the literature. And so it was great to see that come out focused on Baltimore City. But I know that one of the main takeaways was that there's a lot of stigma around that sort of thing, of students going into food pantries that are located within the schools, and the food itself was just not appetizing. That was what came out most, is that it wasn't food that kids wanted to eat, and so they're not going to take it. And so again, I think getting back to the point of really leading with those who are most impacted and to come up with the solutions, that was one of the big findings, is, having them have the ability to, what kind of foods would they want? What kind of solutions do they see within their schools? But I can find the link and share that for people that are interested.
Thank you. There's also a question that sort of builds on that, which is, when will we learn how students are using the cards they've been issued to purchase food? I think that probably refers to the extra ABT money this summer, and where they buy food and the types of food and how many students are using the cards. Will we be able to get that information, do you know?
So I think the same person, Kristen Murray, I believe that she's applying, if she hasn't gotten funding for it, that's her intent, to do an evaluation of those cards to understand the use of that. So hopefully that is something that will be done as well.
And another question for Sue and Caitlin, do you have a map, well, actually for Sha'Von too, do you have a map of church pantries in Baltimore? I guess you have a map of church gardens or farms, but are there maps of church pantries?
We do, and it's not just church pantries, it's any pantry.
Great. Trying to see if there are any questions we've missed. Do you all want to, do the panelists have any questions for each other while I'm looking to see if there are any other questions?
Not questions, but Sha'Von, I just wanted to say I love this idea of preservation and food preservation. It's such a, I hadn't thought about it, and I love that you are, and I think it's such a great thing for us to be thinking through.
This is a comment, I guess maybe for Caitlyn. With regard to data, I've been reading about how to partner with local universities with GIS capabilities to narrow in on some of these indicators of food insecurity. Are there ways that you would like to sort of point out that folks can use your data or speak with you if they need particular data sets? And I know Benia also does this work.
Yeah, absolutely. People can reach out to us. We've done a number of kind of technical assistance sort of conversations with people around creating maps or using the data. If there's a specific way you want to see the data, we're happy to do that as well. So yeah, feel free to reach out. I know that having that license to Esri can be a barrier for some people. And so because we do have that, we do offer the ability to create some simple maps or to assist in any way we can.
Sha'Von, I remember you talking about your research work prior to this position. I don't know if you want to mention that, just how you found the data to be useful or accessible.
Yeah, so actually the graphs that I created was actually from Caitlyn's data set from Center of Livable Future. It was helpful in creating those food environment profiles. And I think that should be the first step of anyone that's doing any community centered work, is to first put a post on the community and know where those food retail outlets are. And I think that the food system map have those resources available, and they have it available where you can take it a step further, because I realized that there were some food retail outlets within Rosebank, for example, that wasn't necessarily added on the food system map. So they were very collaborative in hearing my feedback and updating the map as necessary.
That's great to hear. So SNAP benefits are now available to ISWs online. I think that just means that you can now purchase some food online. I think that's what the question is. Do we have any idea how that's going? I know it's just getting started, right? Anybody know?
I know it's coming to Maryland. I do not know how it's going, but I'm excited. I'm excited to hear when we find out.
Yeah. So two things before we close. One is that I want to point your attention to the chat that has a link to a survey that you can give some feedback on this session. Another question was, how can people get access to this information who do not have internet access? Is there any way that people can get access to the Center for Livable Futures information, I guess is what they mean, without internet access?
Yeah, that's a good question. That makes it a little trickier, because I was going to say email, but that requires internet. There's always the ability to print things, and creating and talking through how best to create a map and with data and printing. And honestly, there is a large kind of sector of GIS, I guess, that looks at more like writing and drawing maps. That can be a really useful exercise for people. So instead of just clicking around on an online map, to actually draw what they know to be true in their community, that can be done as part of a larger community activity, or on your own as well, can be something they could consider.
Okay, and now I think there was a little bit of a clarification of the question, which was also, how do they find out in general about food security if they don't have access to the internet? I guess one way would be to call 211 if they have access to a phone. So I don't know if you have thoughts beyond that. I guess most folks hopefully have access to a phone. Sha'Von, have there been any other ways you've been effective in reaching folks with information about food access outside of traditional means?
Yeah, so one of the two things that we do, old-fashioned outreach, print signs, go door knocking. You walk past somebody, hey, have you heard about this? Post it in neighborhood stores, do all of that. And then the second way that we spread and promote awareness about our programming is by using the church kiosk that's directly in the front of the church. So we put messaging about our programs, like today, come here for the Soil Sanctuary Market. We have fresh produce from farmers. As well as, since we're centered in a church, we also use bulletins, church programs, to also promote our programs as well.
Building on that outreach point, someone's asked if there is any effort to do outreach to unhoused folks to talk about food programs or food access. I think that sort of healthcare for the homeless and some of these groups that do work in more outside of the shelter system do screen for those social determinants, and food security is certainly one of those. So I know that they do that, and some of like Charm City Care Coordination, some of those groups that work with folks that are not wanting to access the shelter system for a variety of reasons do get food information and access. And so I work for the Francis Merrick Foundation. I did not introduce myself. And so I think I can close by just saying one of the ways that the foundations have responded is that we pulled together a COVID emergency relief fund, which operated for 8 weeks. We got about 550 applications totaling about $23.5 million. And the vast majority, I mean, the strongest category was need for food and need to be helping people access food. So the foundations funded about just $3.5 million, I think, worth of funding that was put out on the street in an emergency way. Now, this was not a systemic response. This was absolutely not a systemic response. This was an emergency response. So I think right now where foundations are is wrestling with how to support the food system in a variety of ways. And I think the ideas of food preservation and of creating more, a stronger local food infrastructure. So again, so as we talked about, that if the food system falls apart, if the distribution system falls apart, we're not all stuck empty-handed. But I do think that this is something that we've known about for a long time, like the digital divide. This isn't something that was created by COVID. This is something that has been highlighted by COVID and underscored by COVID. And I think the numbers of people impacted and the numbers of people that are going to continue to be impacted as the $600 supplement runs out at the end of this month, and as housing courts reopen, all of these things are going to exacerbate the problem. It is not going to get better. And meanwhile, I think some of the emergency programs are pulling out or starting to phase out. So I think it's something that we're aware of and that we are very much interested in hearing from folks on the ground about the solutions that they think might help create a more functional system. And in the meantime, I think we're just incredibly grateful to folks like the panelists on this call and so many organizations that really just stood up an amazing response. I mean, organizations that, funded people in a cafeteria style that all of a sudden had to convert to grab and go outside while quadrupling the amount of families they were serving, and doing it by delivery. And the pivots that organizations made and the hours that people have put in to try to care for each other has just been it's the heartening part of this horrible situation that we found ourselves in. And while it's a terrible thing to need it, it has been heartening to see the response, and yet we know we need to continue to support that and not expect people to be superhumans in their ability to so I think the data this shows that having the data really helps us make the case, and I think the more communities and neighborhoods, which is what BINIA does so well, have access to that data, the more able they are to make the case to build the case to change policy as well as access. So I just want to thank everyone. I know it's late. I know it's been a long day for everyone. I think it's been a fantastic panel, and I'm so appreciative of everyone's input. And Bina will be back in touch with you all with the follow-up information and presentations. And thank you so much. Thank you, Caitlyn, Sue, and Sha'Von.
Elizabeth, for moderating. You did a fantastic job, and the panel was just off the hook. I couldn't even summarize it in tweets. I was like, everybody just watch the whole thing. It's so good. And I do want to also acknowledge what Elizabeth just said. We know a lot of people are struggling right now. We are with you in spirit. If there's anything that we can do, please let us know. We hosted Baltimore Data Week, even knowing kind of what everybody's going through, including kind of losing jobs and not having access to food. But we thought we should do it and continue doing it in this virtual way as some way to help in some way. So hopefully this was a hopeful and helpful session, and you guys all did a fantastic job. This was the end of day 3 of Baltimore Data Week. We've all been learning so much.